This broadcast is brought to you by Phillips Learning Center. The full e-learning course on diagnosing coronary artery disease and cath lab intervention can be found at theonlinelearningcenter.com under the cardiology section of the course catalog. This course reviews the anatomy of coronary artery, heart chambers and blood distribution, coronary artery disease and its risk factors, diagnosis of myocardial infarction and angina, and diagnosis using ECG, other common tests, and suitable therapeutic measures. Coronary artery disease is defined as the progressive accumulation of atherosclerotic plaque in the walls of the coronary arteries. The right coronary artery passes between the pulmonary artery and the right atrial appendage and then runs in the anterior atrioventricular sulcus groove toward the crux of the heart. The left coronary artery arises from the left posterior sinus of Valsalva and passes forward between the pulmonary artery and the left atrial appendage. The heart is a muscular organ that, through its contractions, provides the force necessary to deliver blood to the cells. The heart has 4 chambers but functions as a two-sided pump. The 4 chambers include the right atrium, right ventricle, and left ventricle. The right side is a low-pressure system pumping deoxygenated blood to the lungs. The left side is a high-pressure system pumping oxygenated blood to the body. In coronary artery disease, the plaque within the lining of large and medium-sized arteries, referred to as atheroma, gradually enlarges, becoming more fibrous with age and can cause sudden occlusion of the vessel. There are 5 stages of atherosclerosis, starting from appearance of fatty streaks and resulting in myocardial infarction or ventricular fibrillation. There are several risk factors which are only indicators of cardiovascular disease. Further clinical signs and symptoms also need to be present to diagnose coronary artery disease. This illustration shows the primary indications for the risk of heart disease. Let us consider the risk factor, hypertension. Blood pressure is the force exerted by the blood against the wall of the arteries. High blood pressure or hypertension is caused when more blood is pumped by the heart or if the diameter of the artery is narrowed due to plaque formation. Early diagnosis of coronary artery disease can prevent myocardial infarction. The diagnosis is based on past history, identification and duration of pain, and associated symptoms like shortness of breath, nausea, and vomiting. Blocks in the arteries result in heart attack. Major risk factors are older age, high blood pressure, high blood cholesterol, and diabetes. There are 3 primary types of angina: stable angina, variant angina, and unstable angina. Obtaining a 12-lead ECG is one of the first tests done to evaluate myocardial ischemic and infarction patterns. Abnormalities in the appearance of the QRS can determine a previous MI. Changes in the ST segment can determine if myocardial ischemia is present or if an acute infarction is occurring. Other common tests include exercise stress test, Holter ECG, stress echocardiography, and cardiac catheterization. Angina is treated using nitrates, beta blockers, and calcium channel blockers. Important therapeutic interventional measures include thrombolytic therapy, percutaneous transluminal angioplasty, stent, and percutaneous atherectomy.